Okay, good morning. My name is Michelle. I'm going to be your nurse today. I'm here to evaluate your head, ears, eyes, nose, and throat, otherwise known as the HEENT system today. I'm going to start off initially just by asking you some basic intake questions. What is your name?
Debbie Smith,
And what is your date of birth?
May the 2nd, 1955.
Do you have any significant medical history that would be related to that system, meaning any operations or any issues with your head, ears, eyes, nose, or throat?
Tonsillectomy.
Anything else?
And I had a thyroid nodule, and I had my thyroid radiated.
Okay, do you have good vision, or do you use glasses or corrective lenses?
I'm farsighted.
And do you have corrective lenses that you use frequently or only to read?
Just to read.
Okay. I'm going to start out by initially inspecting and palpating multiple areas of your head. I'm going to be feeling your head and your hair for symmetry of your head. I'm then going to palpate the fronts of your face to check for your sinuses or any tenderness. I will then move on to your temporomandibular joint, and I will have you open and close your mouth. And I will be documenting as I am doing your assessment, so if you have any questions along the line, please feel free to stop me or add any information as needed, okay?
Yeah.
Initially, I'm just going to feel your head. Do you have any tenderness as I'm touching you?
No.
Okay. Nothing back here?
No.
Okay, now I'm just going to palpate the fronts of your sinuses. Do you have any pain here?
No.
Okay, do you have any pain here?
A little.
Do you have any history of sinus infections and/or sinusitis?
I've had sinus infections in the past.
Okay. Next, I'm just looking at the symmetry of your face. Your eyes are equally symmetrical. Your face is symmetrical. Can you make a nice big smile for me so I can see that? Cheeks are symmetrical. I'm now going to go down and just press onto this joint back here. I want you to open your mouth wide, and I'd like you to close it. Did you have any tenderness as I was touching this
No.
there? I'm now just going to feel down your neck to see your vessels that come down to make sure you have no, what we call a jugular vein distension. Your neck is nice and flat. I don't see any distension of the neck veins. Everything is equal. I'm now going to move on to your thyroid examination. There's going to be two components to the thyroid examination. Initially, I'm just going to palpate the area. Then I'm going to give you a glass of water and have you swallow when I tell you to. Please let me know if there's any tenderness as we're doing this. Do you feel any tenderness here?
No.
Do you feel any tenderness here?
No.
Okay. Now I'm going to have you take a sip, hold it in, and when I tell you to, you're going to swallow. Oh, you have that? Okay. Please swallow. I do feel like what could possibly be a small nodule on the left side of your thyroid. Is that the case for you? Is that part of your medical history?
It's the right side of my thyroid.
Oh, the right side. I'm
Yeah.
sorry. I'm looking at you from my left.
Yeah.
So your right thyroid has a little bit of a nodule. I'm going to check the left side now. Take another sip of water. Swallow. This side feels perfectly normal. I don't feel any nodules or anything on this side. Okay, next area we're going to move to is the muscles of your neck and the functioning of the neck. I'm going to put my hands on your shoulders, and I'm going to have you shrug against me just to see the strength of those the sternocleidomastoid muscles. Push against me. Excellent. Next, I'm going to put my hand on your chin. You push against me. Just that will tell me about the musculature of your neck. Press against me. Great. Press against me. Great. Now I just want you to move your head and neck normal. See how good range of motion. Do you have any pain on movement or anything with your neck?
A little, yes.
Now, why do you have pain and movement with your neck? Do you have something else skeletally that bothers you?
I also have fibromyalgia.
Okay. Do you have anything else going on with your bones that would cause you to have pain?
Osteoarthritis. I have stenosis in my spine.
Okay, those could be things that could make that area a little more tender for you. Next, I'm going to move on to your eyes. As you were saying before, you have reading glasses solely for the purpose of reading. You drive and everything without glasses,
Yes.
correct?
Mm-hmm.
I'm just going to dim the light in the room so I can check pupillary response, and I'll look at your eyes. Give me one moment. I just want you to look straight ahead at my nose, and I'm just going to come in with a light, and I'm going to check for the reflexes of your pupils. That pupil was reactive and reactive. Perfect. I'm going to come turn the light back on. Give me 1 second. Okay, your eyelids are normal, your eyebrows look normal, all the musculature in the area, blink, open as wide as you can, all are even and open up symmetrically. Next, we're going to just look at the color. Your sclera are nice and clear and white. You don't have any discolorations. I'm also going to check underneath your eyelids to make sure that your sclera are nice and pink. The conjunctiva are nice and pink, which is great. The clarity, you see everything clearly. You don't have any type of floaters or anything that's going on in your eyes, correct?
No.
Last thing I'm going to check for your eyes is what we call the 6 cardinal fields. I'm going to have you look at my finger and just follow my finger from where I am. Perfect. No pain or change on that movement, correct? No. Okay, let's double check that we have everything that we've looked at for your eyes. Perfect. Now, lastly, we're going to do ears, nose, and throat. What I'm going to do then is I'm just going to first initially look at the placement of your ears, which what I would be doing is drawing an imaginary line from your eye to the top of your ear, which looks perfectly in place. And your ear, top of your lobe is about 10 degrees back, which is exactly what we like to see. Your ear canals look free and open. Do you have any issues with your hearing?
No.
Excellent. Next, I'm going to now look into your throat. I'd like to see, for pink, anything to do with your teeth or your gums or anything that's going on in your mouth. If you can give me a good ah.
Ah. Ah.
I can see that you don't have tonsils. The back of your throat is nice and pink. I also see that you have a plate on the top, which means you have lost your teeth on the top.
Mm-hmm.
Was that several years ago, or is that something new?
Many years ago.
Okay, so you've had that plate for a while. Do you have any gum disease or anything underneath the plate?
No.
I'm just going to look at your bottom teeth. If you can pull your tongue back, perfect. Your teeth look good. Any issues with the teeth on the bottom? Any issues with the gums or gum disease on the bottom? Okay. I'm going to do one interesting test for your hearing. I do not have a tuning fork, unfortunately, but I am going to do a whisper test. I'm going to have you close your eyes, and I'm going to come on either side of you, and I'd like you to tell me what side I was whispering near.
Left side. Right side.
Excellent. You heard both of those sides equally?
Yes.
Excellent. We're just going to look at your nose as well now. Do you have any issues with your nose? Are you having any discharge or congestion at this point? Your nose is symmetrical. It doesn't look like there's anything abnormal about it. Are your adenoids intact, and you didn't have surgery on that with your tonsils, did you?
No.
Okay. I'm trying to think if we have anything else. I may just check your nose, make sure everything is okay. We've looked at your teeth. I think we may have covered most of it. Do you have any issues or concerns today about these systems? Do you have anything new going on with your hearing or mouth or eyes or anything whatsoever? No. Okay, well I think that completes our assessment of your head, ears, eyes, nose, and throat. Thank you for your participation.
Thank you.